Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Once again, you're welcome to another episode of the Doctalk show, where today we discuss bladder and bladder conditions. I'm Dr. Fiona Atuhebwe, your host, and with me in studio, I'm with Dr. Frank Asimwe Rubavinda, a urologist at Mulago Hospital. Welcome once again, Dr. Frank.
Thank you.
All right, so today we shall talk about the bladder and bladder conditions. We know many people talk about UTI. Everyone keeps saying, I have a UTI, my child has a UTI. We shall briefly discuss what a UTI is, but we shall focus on what the bladder is and the conditions that affect the bladder. So, Frank, and remember before we start, as we go ahead, please, you can send all the questions you have about the bladder and bladder conditions to our social media platforms on Facebook and follow us on Twitter. And remember to also subscribe to our YouTube channel. So, Dr. Asimwe, to sensitize the people, what exactly is a bladder?
Bladder is a muscular organ which is located in the pelvis of the body. And its function is basically to collect, store, and expel urine.
Okay.
I've got my model here. I could just show you on this model. That is the urinary bladder.
Okay.
Okay. And we need to be cautious because there's also the gallbladder. The gallbladder is up in the liver, and it has to do with digestion and storage of bile. This one collects urine.
So you said it's in the pelvis, around
Pelvis,
this
yes,
region.
yes.
Okay.
Actually, it can't be felt. It's around where your belt sits and beneath, lower.
Okay.
It's hidden by the pubic bone. So your belt sits around here, the pubic bone. So its top part, only when it is full does it reach your belt region. But most of the time, it is way below the belt region. So normally, it should not be felt in the abdomen. Its function is to collect, store, and expel urine. And as you can see, it neighbors the prostate, which we talked about in the previous shows. And not too far is the rectum. And in front of it is the pubic bone. And then the urine will come out through the urethra. In the case of men, it will go through the prostate and then through the penis. In the case of females, there will be no prostate, and it will just come straight into the urethra and then out.
Okay.
So that's the bladder for you.
So we are here to discuss conditions that are affecting the bladder. What are these conditions that will affect this organ, and what do they present like?
There are various conditions, the commonest being infection. Infection of the bladder is called cystitis.
Okay.
And it's very good that the doctors who treat infections in that area differentiate where this infection is. Mm-hmm. The one in the bladder is called cystitis. If it is in the urethra, it's called urethritis. If it is up in the kidneys, it can be called the pyelonephritis, or it can be prostatitis if the prostate is involved. The thing is, the symptoms are kind of similar, but for you to effectively treat this infection, you need to zero down on where it is. Although infection in one part can affect the other part, but it's good to zero down on which part is involved. So the urinary bladder, there can be infection.
So just a minute. So now that you're talking of the infection of the bladder, you've talked of the cystitis, the urethritis, the pyelonephritis, and all those other urine-related organs getting this. So most people will say I have UTI. Before we move on with cystitis, when they say, people confuse everything as UTI.
Yes. UTI basically means urinary tract infection. And the urinary tract begins from the kidneys. We actually call them the minor calyces. You can even make it better and call them the collecting duct, because we're talking about the part where urine has been fully formed. It's now called urine, and it's not being absorbed. So from the collecting duct to the minor calyces, to the major calyces, the renal pelvis, to the ureters, to the bladder, to the urethra. You can see we're talking of 7 organs where the urine goes. So infection can be in any of those 7 parts. And therefore, when you say UTI, you are just blanketing up so many things. Because the reason why we want to tease it out you've got different organisms which like to infect particular parts
of the urinary tract.
Yes.
So we want to differentiate between what we are discussing now as cystitis,
Cystitis.
infection of the urinary bladder.
The bladder.
Thank you very much. So what other conditions would affect the bladder?
The other ones which are a little bit common include neurogenic bladder. Like I told you, the bladder should collect, store, and expel. During the collection and the storage, the bladder should freely expand, okay, and accommodate the urine without contracting. It must be relaxed. Then at the time you want to expel, this is when you have reached your place of convenience, you have given the signal, and preferably all the clothes are off. Then it can begin contracting.
To expel the urine.
To expel the urine. And that means the muscles at that time will contract, the sphincters, the brakes should relax, and then the urine flows. So those issues of neurogenic bladder can start during the feeling.
Okay.
Instead of it relaxing, it begins contracting.
Okay.
As if it wants to expel. And yet you have not yet allowed it.
To expel.
And those are patients who, when they have just a little urine, they feel like passing it. Now, in the normal physiology of the bladder, when some urine reaches around 50 mils, there is a signal which comes to alert you there is some urine. But the body, the higher centers, usually override and inhibit the contraction. So the bladder continues to relax and accommodate, contract and accommodate.
That is how when you feel it and you're on a bus, you can accommodate it
ignore.
Until the bus stops,
Yes.
makes a stop.
Even when the feeling is so strong, still the bladder does not necessarily contract. Your higher centers stop it from contracting. It is when it contracts that it spills, that comes out. So the higher center should control. So people with neurogenic bladders, this coordination is lost. Either at the feeling or at the storage, or now at the expulsion. At the expulsion, the time may come and you want to expel, you reach there and you are ready to expel, and the bladder is not contracting.
Oh, nothing comes out.
Nothing comes out. That's called bladder atony. So the bladder has failed to contract effectively. Or it contracts and does not complete the contraction, so not all the urine comes out. That's when you begin getting a bit of urinary retention, a high residue. Or the sphincters fail to relax because the coordination is during the filling and the storage, the bladder muscles, we call the detrusor muscles, they relax, while the sphincter muscles keep contracting. Now at expulsion, the opposite happens. The bladder muscles, the detrusor muscles contract, and the sphincter muscles relax. So there's this condition called detrusor sphincter dysynergia. At the time you want to expel, the bladder actually contracts, but the sphincters
gates do not open.
They don't open, they don't let go. So that's another.
So things are working right at this end, but down here they are not working.
It's not happening.
But then we also have incontinence. We have these people who the urine just comes out.
Yes, incontinence is in 3 categories. There is what we call urge incontinence. That means you feel like passing urine, but you are not able to make it to your destination.
Okay.
The desire to pass urine is so strong, and the contraction is so strong that the urine spills. But you have felt it. That is urge.
Okay, you felt it, but you just don't get there.
Then there is stress incontinence. Stress incontinence, when you're seated or when you're sleeping, no problem. But as soon as you increase your intra-abdominal pressure, this can be as little as just standing, can be as little as talking, can be as little as coughing, laughing, or straining, or you lift something. So there are all those grades. There are about 5 grades.
Okay.
It can happen at any one of those points. That is stress incontinence. You don't feel the desire to pass urine, and urine just leaks.
But because you've exerted pressure on the bladder, then it just lets go.
Let's go. Then there's what we call total incontinence. That's when you have got a hole. That's the one where the fistulas fall in. There the urine just comes in and walks out, comes in because there's a hole, there's an abnormal connection. So incontinence, urge, stress, and total incontinence.
Okay, so do we also have, like any other organ, cancer? Can cancer affect the bladder?
Yes, the bladder can be affected by cancer, and it is one of the conditions of the bladder. In this case, it manifests with blood in urine. And usually we say it is painless hematuria. There is no pain associated with the blood in urine. Okay,
so the urine is coming out with blood, but there's no
pain. Of course, pain can come in later once the disease gets advanced. But at the early stages, there is no
There's no pain. Yes. Okay, thank you very much, Dr. Ravinda. We are going to look at risk factors. Who are these people who are at risk of getting these bladder issues? We shall see how we diagnose them and then generally how we treat them and how you can prevent issues to deal with the bladder when we come back from the break. Remember to follow us on our social media platforms on Facebook and Twitter, and also subscribe to our YouTube channel, The Doctalk Show.
You are watching The Doctalk Show.